I'm recording now, just getting a drink. It's been a little bit crazy hectic, but I'll tell you about that in a second. So we've got people coming in. I'm just thinking if I should turn off that waiting room and let them just arrive. What it looks like is that when I use a waiting room, people sort of, I can accept them as they come. Hopefully it's not going to disturb us too much. So while we're getting kind of settled in here for the first 2 minutes or so, I'm just going to see if I can change that to just accept people into this. Let me see here. So more. Put attendee in waiting room on entry. I'm going to take that off. And then hopefully they will just get in. So if I see that blinking, I'll just let people in as they come. There are quite a few people signed up. Sometimes when we have these online meetings or webinars, stuff like that, people are used to getting the recordings, so they will actually sign up and not show up. So hopefully we'll get a lot of people that have actually signed up to actually come and not just rely on the recording, because part of this info session is really to get some people's questions answered, and so that I can just be able to chit chat with you all we like. So hopefully they'll show up and we can have a really lively conversation. So I think that you have the capability to unmute yourself, I believe, or if you want to be on video and be able to talk to me and look at me and I can look at you, you can do that as well. I'm going to wait just like a minute or two to go through etiquette for Zoom, because sometimes we'll have like a ton of noise in the background, or someone like walking around with their phone and stuff like this, and can't really pay attention. It's super distracting for me and then everybody else who's listening. So we'll go through that a little bit when I get rolling here. But we've got Heidi and Lisa here right now, and if you would like to just introduce yourself. If you want to introduce yourself, hi Heidi. You're more than welcome. If people just hi, how are you?
Great.
Glad to have you here. And just so you know,
for doing this.
Of course. I think it's a really good way to get to know each other. And I have to say too is that when we're recording now, so just so everybody knows that we're recording, and that whatever if you don't mind being on camera or whatever. We're recording, and then if you don't want to be on camera, you just turn off your video, put yourself on mute, and we're good to go. So you know what I'm going to give you, because you were here on time, and Lisa knows me, and I can let her introduce herself if she wants to as well, but we have time. People who show up kind of early, like not early but on time, you can have a little bit of the floor. So if you want to let me know what you're doing here and why you're interested in finding out more about the program, that'd be great.
Okay. So I have a PhD in psychological and religious studies. I've been in private practice for like 20 years.
Yeah.
Doing like mindfulness therapy. And over the past couple of years, my daughter's been struggling with a lot of health issues. Right now, she was recently diagnosed with mold toxicity. So we're trying to figure out that whole thing. But I think through, all of this, I've become much more knowledgeable about functional medicine in general, nutrition and the benefits of supplements, changing up what you eat, all those kinds of things to create greater health. And so I'm interested in your program, particularly for the psychological side, for the mental health issues, because I think there's so much misdiagnosis, or let's say anxiety, depression, other psychological issues that clinicians are not looking at what's going on physiologically with people. What can they do? What would they be lacking in, or what do they have going on that could be whether it's mold or some other issue, or like my daughter's been misdiagnosed with ADHD, all kinds of stuff that I think there can be more healthy solutions to than looking at psychotropic medications. And while therapy is good, I think there are many other things that can be done alongside of that to be beneficial. So I guess for me, I'm looking at how can I get more tools in my toolbox to be more helpful to folks.
I love that. I love it. I love it. I love it because that is one of my missions. I don't know if you know this, but about me and what I do, like how much you've read and stuff, but it's a huge part of what I do is finding out what kind of like inputs that we have, toxicities, deficiencies, diet, nutrition, lifestyle, exercise, how that impacts our mental health. And I would say, and I don't know if you agree, I actually did 3 years in psych before I ended up jumping ship to a different degree. So I really started out in psychology, like, I don't know, I'm not going to tell you how many years ago, but ever since then, I've been really interested in that piece. And then, and going through functional medicine and finding out more about how those things that we just talked about affect mental health, huge. And I would say, and tell me if you agree or not, but I would say 90% is like that you can actually affect people's mental health probably 90% of the time if you address those things, even traumas. I mean, you know, but that's actually even physiologically, there's like physiological responses of the body to trauma even. So, you know, so I think that there's a huge percentage of, you know, the issues that are not, like, people aren't born crazy. They're not, you know, they don't have like all these mental health illnesses because their parents did. It's really has to do with environment. What do you think about that, Heidi?
Well, I'm believing that more and more. You know, obviously that's not the way I was trained. And I started to notice this a few years back working with clients, and there was nothing to really explain their symptoms, nothing that was going on in their life, nothing that happened in their history that would explain why they're so depressed or why they have so much anxiety. And I was hitting a wall over and over again. And now that I've educated myself more on this topic, I'm like, oh shoot, I wish I knew back then to try some of these other approaches to see whether they would make a difference for these clients, that maybe they were you know, having they had some major deficiency that you know, I wouldn't have known about. So I, you know, I agree with you. I'm not sure what percentage. I just feel like we're still learning about this, but I'm sure it's very high. And I agree with you that, you know, why do we see such an increase in mental illness over the past couple of decades too? You know, I think when we look at the toxicity of our environment, the poor nutrition that we have, I think that helps to explain whether it's autism, anxiety, all of these issues that we're just seeing skyrocket these days. So I think there's a lot in our environment that affect that.
Yeah. Okay, well, we just gave a really good example of what we do in the program. Like we do, so I let Heidi introduce herself because she was the first one to show up, and I'm really glad I did. Because, you know, this is really what we do. We unpack all of this stuff regarding, so I'm going to put us on gallery here, like, so we can see everybody. We unpack all of this stuff because we want to get to the root causes. And so that's why I'm always looking for that. So for example, we were just talking about mental health. We, you know, so what I teach is that we need to unpack that and getting to what's really happening. So because I mean, a lot of times in psych, you know, we're looking at, you know, symptomology, but we're not actually looking at the brain. We're not actually looking at the physiology. We're not looking at the chemical reactions, all that stuff. So we're kind of like guessing a little bit in some ways. And don't get me wrong. I mean, I was in that profession. I do a lot of that work. I do that. I used to be an academic coordinator for the University Certificate in Counseling Women. And so we did a lot of advocacy courses and, you know, issues in women's health courses in that program as well. So there are lots of moving parts, but some things that I've really been founding with chronic illness is that children who, like, let's say pandas, like, so we're getting a lot of things that are sort of like classified as mental health issues, but really we were just saying toxicity, you know, so we're talking about metals, mold, you know, things like that along those lines, chemicals. And then we're talking about deficiencies. So something like pyroluria can create the situation where you look like you're mentally ill because you're hyper anxious, you're, you know, sensitive to light and sound, you can't actually handle, you know, any sort of stressors. So that's really a deficiency in B6 and B6 and zinc, and some oils. So, you know, and then we're getting to the infectious agents too. So if we're talking about infection, you know, we have the pandas kits, and that looks like it's a psychiatric issue, but really it's an autoimmune disorder and creates inflammation in the brain. So, you know, knowing this stuff and being able to have the tools to deal with the root cause, that's like huge. It's huge. And some of these kids, you know, I've talked to the parents who said, okay, we worked on this, and I'm so grateful because my child would be in a mental institution right now if we hadn't dealt with that. And then we're looking at our teenagers with high, you know, they're all eating junk food and they're exposed to Wi-Fi constantly every day, all day. Their schools aren't exactly, they have terrible lighting or bad food or bad water. And then they're like, this is what we're seeing, mental health problems in that demographic as well. Not to mention neurodegeneration at the age of like 20. You know, why are we forgetting our keys and where we were in mid-sentence and not, you know, what's happening? So yeah, so this is a very big part of the program, Heidi. So I appreciate you bringing that up, and I appreciate your background for sure. So it's really fantastic. So, all right, so we're going to move on to actually going through this stuff. So that, like I said, that was a really nice, I guess, example of what we do. Lisa will know. Lisa's actually here, Lisa Lash. She's one of my current students, and they're moving into month 6. Oh my goodness. Okay, they're moving into month 6. So they're going to be done before you come in, but they're never done. As you know, if you are taking the program, we have a Facebook group, and they're never done. Like the people that were in the first group are still there, and we share information. We work on cases. We, you know, post about new things that we're learning about, research studies, you know, summits that are going on that you can, you know, watch yourself or share with your clients, podcasts. I always put new stuff in there that I'm experimenting with. I've just been talking about PEMF therapy lately, and we've been talking a lot about mold illness and such. And we've got, depending on who's in there, we gather so much information. We also have a section in there where we have files. So we keep all of the files. Most of them are there. We have 2 other places where we keep all of the information for the program, kind of like a holding house. One of them is a Google Doc, which I like because it's dynamic. I can change, you know, the information in there anytime I need to. I can just go zoop, put a link in there, and that's like a catch-all for everything that's going on, like the structure of the program. So I'm going to show you that in a minute. And then there's also a place that we go to, which is the course website. And that's where you can kind of like traditionally work through the course one step at a time. And so, you know, if you're in the lesson or module 1, lesson 1, you can show complete and then move on to the next lesson. So the structure, so I won't get ahead of myself here just yet. I'm going to actually share my screen, and I'll get to the proper screen that I want to share. And what I'm going to do is, you might have seen this before. If you've looked into the program, and if you have pulled down anything like downloaded this is actually just the it's the info package. I call it the info package, but it's also like it contains the syllabus and a bit of information about where I'm coming from and how I view health, because that's really important to know, because this is the angle that we're going to take throughout the whole program. And so my mission is to expand and broaden people's understanding of health, that this is sort of innately and inherently natural. It should come to us naturally. And we're finding ourselves in this position today where it's not really coming naturally. It's actually very difficult for people to be healthy. I don't really actually know a lot of healthy people, really, in the true sense of the word. I always use my massage therapist. He's a Thai yoga massage therapist. And I use him as an example of like the only person I know that is truly healthy. Like, he's happy, he likes what he does, he gets to massage people, make them feel good every day, he travels every year, going to like all kinds of different places, learns new stuff, you know, but brings it back to his community, and he's just like biking all the time and super active and no major issues. I mean, we can't all be all like that all the time, and that's okay. You know, this isn't about perfection. It's really about, you know, a state of wellness and health that is beyond the medicalized model of, you know, pilfering ill or just feeling kind of crappy all the time and thinking that that's normal, because it isn't. So this is what we're looking at. We do the first few lessons are about that, the medical model, how we are to unpack that and unravel it. And then we get into a bunch of other stuff that I'm going to kind of go through here right now. All right, so you can read this. I can send this to you if you haven't had a chance to look at it yet. I don't want to take too much time. I mean, I could read a little. I'll read this first page here for sure, and then I'll let you read more about me and that kind of thing if you want to know about my background, so that you know pretty much what I'm going to teach, because you'll know what where I've studied and what I kind of am interested in. But that's at the end here. So our current situation I'm going to be doing this in the program quite a bit. It's sort of like, I don't want it to be like beating a dead horse, but I really do want this to be very clear, that this is what the problem I'm identifying, but we don't stay and focus on the problem. We are busy creating the solutions, and some of them are actually simpler than we actually think. So we get complicated so that we can simplify. Let's put it that way. Complicated. We talk about the complexities so we can simplify. All right, so North Americans spend more money on healthcare than most other populations in the world, yet are some of the sickest people on the planet. Other countries that have been adopting the North American lifestyle are enjoying less vitality and suffering from increasingly poor health as well. The situation is serious, and when it comes to reversing this downward spiral, there is no time to waste. So think about this for a second. Is there anyone in your life that you know to be healthy? So this is what I was asking, this very question. And when I say healthy, I mean, is there anyone in your life that does not have any sort of chronic condition? And I don't mean just like a big, huge chronic disease. You don't necessarily have to have autoimmunity or arthritis or a neurodegenerative disease, Parkinson's, and ADHD, whatever. It could be something like chronic acne. It could be just poor mood. It could be sleep issues, insomnia, or or sleeping too long. Just feeling generally unwell. I think those are chronic conditions as well, and we talk about all of that in the program. But maybe it's just me, but I can't think of a single one. Well, actually, that's not true. I said my massage therapist. So, and are you with me here in that you also are asking the question why? And again, Heidi was just saying at the beginning of our session here, she's asking why. Like, what's going on here? What's going on with this mental health? She's noticing that trend. Having, a master's degree in you said psych or something about, like, it's in the psychological field anyway, so she's got a master's. And so, so most of us have forgotten ourselves. We have forgotten what it means to be healthy, settled for a new normal of suboptimal health, and are now relying on old and dying systems to keep us alive. The medical system is overburdened in finances, labor, and resources, and quite frankly, failing in every capacity. And that's a big statement, and there's a lot of people that are going to maybe be offended by that statement because they're working hard in every capacity to make those systems work. But really, sometimes what we need to do is not put the blame or the burden on the individual, but talk about what the system is actually doing and how we can improve that system to make the work of each and every person in there doing those jobs easier. Because there's something wrong with this going on at a systems level. And same thing with the body. I mean, we can compare that to how your body runs. It's a system of moving parts. And so we need that system to actually be working properly for all the rest of it to kind of shake out. So medical mistakes kill tens of thousands of people every year. And it's just a fact we have to face. It just happens. It's not only mistakes, it's also, medications that weren't appropriate, that, cause side effects, damaged, organs such as liver, kidneys, mental health too. Like, we might cover up symptoms and actually ignore things that are happening under the hood that we need to address. Because if we cover up a symptom, there could be way worse things happening down the road that we were actually ignoring. It's like turning off the fire alarm when the house is burning down, that analogy. So, antiquated protocols and ineffective treatments continue to prove not only ineffective, but often harmful. Disregard of natural processes and the life-giving power of lifestyle and nutrition rob our families of safe ways. Safe ways. We still need to do this, but we need to do it safely to build health. And drug interactions and side effects contribute to organ damage and unpleasant symptoms, some of which people suffer from every minute of every day, and why. So I don't want to demonize the medical profession. What I want to do is put it where its place is. So the medical profession has a place. My mom just had emergency surgery, 9 to 10 days ago. Actually, it wasn't even, I don't even know. It's like, no, it was a week ago yesterday. So 8 days ago. And had she not had this surgery, she would not be here. Her whole colon would have been dead because she had a hernia wrapped up in the colon. They had to take out like this much. That's another story, and you always hear my stories, so I'll probably tell you about that another time. If you're in the program, I'll tell you all about it. But, she wouldn't be here. I have a daughter who has type 1 diabetes. She wouldn't be here if it weren't for insulin. There are many, many, many instances I can see that. But when we're talking about health and building health from the roots up, my wheelhouse is lifestyle It's becoming less toxic, more nourished in every single capacity, mind, body, and spirit. So we use a lot of tools that aren't necessarily, you know, just diet and lifestyle. They are, and we learn all about that in the program. But it's also, you know, what we would call alternative treatments and therapies, which aren't actually at all alternative. They're just outside of what we understand as being medical. So plenty of stuff that we go through in those categories. And so we build a really big toolbox that is extremely beneficial for health building and recovery. So our elderly slip through the cracks of our systems, and I've seen that firsthand in many, many people, and that's something that really disturbs me. And so that's one thing that I've been kind of, you know, being a catalyst for change in that category. And not every trainee needs to do that. We just learn how to look at those things and make the change in the areas that we want to make change. Our families are left disempowered and confused due to partial and often misguided advice. And our children are handed diagnoses in place of merit badges with no end or solution in sight. And that's just like, it really happens quite a lot. We can tend to identify with labels. Sometimes it helps us to label or identify something, give it a name to make it real. But then the point of that is not to stay in that ADHD, autism, pandas, whatever diagnosis, arthritis, you know, we don't want to stay there. We want to use that as a starting point to give us a define, to help us understand why we're having the symptoms we're having, and then be able to move forward from there. So that's what we do in the program, and also that's how we work with our clients. People are scared, unwell, stressed, confused, and alone. Conventional medicine is focusing on the wrong things, like suppressing symptoms, and reactionary medicine. And not all the time, like I said. I mean, but when we're talking about chronic illness, it's not, it's much more conducive to be responsive than reactionary. And ignoring the very things that will make us healthy and keep us that way. Like lifestyle choices, community, family, compassionate support, and proper information that recognizes that we are whole, multifaceted beings that need harmony in every aspect of ourselves and our environment. So again, I mean, we do functional medicine. We talk about that in this program. We talk about holistic health. We talk about lifestyle medicine. We talk about choice, autonomy, critical thinking. We talk about getting to the roots, investigating, and then we get to solutions, support in every single capacity, and then how to take care of ourselves as practitioners while we do that. So I'm going to look and see that I have somebody chatting here. I'm just making sure I don't have a pressing question. Yeah, so Chris had a question. I'll address that right now. She says, how is your certification similar to or different than functional health coaching? I mean, I think that it depends on the Functional Health Coaching Academy. You might be talking about IFM, which is the Institute for Functional Medicine. I haven't actually taken their program. What I started out with was functional diagnostic nutrition. So I'm a functional diagnostic nutrition practitioner. And the reason why I did that was because I didn't have access to the information or the testing that I needed when my daughter was first diagnosed with type 1 diabetes. And I learned a world of things, and I got access to all these labs because, as any mama who's on a mission, and it's kind of a little awakened to the fact that they're not getting the right information, and I know there's something they can do. I had to do it myself. So that's how I started there. I also got, I was the first one to test drive Documenting Hope's practitioner program as well, because I was working with them writing their curriculum. And so I've done a couple other designations, health coaching designations, but not the functional health coaching. And what I think, though, by looking at their syllabus, and I've done their info sessions and that kind of thing and read their materials, is that they do have like a more holistic approach than a traditional, doctor. They value the relationship between the client. They still call them patients, though, and the doctor or the practitioner. And I think that their stuff is very good. I think it's more along the line, it's a little bit more medicalized than I tend to talk about and think about, because it is coming from a functional medicine perspective. So the health coaches in the functional health coaching programs, they're actually working alongside the functional medicine doctors. We do that too, but it's not the only thing we can do, and we can do a lot more things than that, because our toolbox is much more expanded. And also, I mean, they will, open up that discussion about alternative. I don't want to say alternative. I just want to say holistic or you know, outside of the medical model, those treatments and therapies and protocols and programs, they talk about, they open that discussion, but we go into a little bit more depth. We're much, I mean, my program's really heart-centered, so we have a lot of really personalized discussion. And so I think that as I go, and if you have more questions, Chris, about that, please do ask. You can pipe up when I sort of open up the floor for questions, and put yourself on video or audio, whatever you'd like, or just chat. That's totally fine. But when I'm going to go through each of the lessons and modules, and then if there's something that you're like, okay, I still don't see how it's different, or how they compare, then I'll address those questions at that time. So I hope that helps just for now. All right, so again, I don't want to demonize. I just want to say that this is what's happening. We need to look at that, because if we don't look at the truth, we can't make good change. So, and we really do see, yes, good, she says it's helpful, wonderful. And so we do see that there's a problem, and that's okay. We don't have to, I mean, if anybody is working in a system or a space where you're actually professing to help people, I think we need to be open to what needs to change if it's not working. And I don't know anybody who hasn't been in a situation in an office somewhere feeling like they've maybe been ignored, or something's been missed, or they're just feeling like there's something wrong here, or they don't have all the information. Maybe they were told, like, you know, by a healthcare professional that diet doesn't matter, and then you just think, that's not even logical. So, you know, so we need to look at those problems to see what needs to be fixed for our clients, and the way that we can help to educate them and empower them. So Abraham Maslow is quoted as saying, when all you have is a hammer, everything looks like a nail. So we don't want a bunch of hammers, you know, so such can be the case in our current model of healthcare that is imprecise, reactionary, even ignorant at times. Oh, I'm so hard on it, aren't I? Taking liberties and chances with your family's health. We just can't let this continue. So HFF practitioners will turn that around and guide people to vitality through precise, preventative, responsive care, because we don't use hammers, okay? We use a really nice toolkit, and sometimes it's a feather. It doesn't have to be a hammer. It can be a lot of different tools depending on what we need. All right, so the purpose of the program, I'll go through this as well, actually. So potential HFF trainees are dedicated, curious, forward-thinking people passionate about helping others regain their intrinsic right to health. HFF practitioners are knowledgeable about the science and physiology of health and recovery, but also well-versed in how to support people to achieve better health and ultimate healing, focusing on the whole family and using functional medicine, lifestyle medicine, support, advocacy, and our own mix of skills and talents. So what's really cool about the program, and is if you enter the program, you'll see that everybody has a strength. Everybody comes from a very different background. And what I look for when I'm actually accepting applications for the program is that that's that certain something, you know, that's just like a drive to learn more, you know, so people that just actually see that there's something outside of what we're sort of taught, because we're all critical thinkers. I don't mean criticism, I mean critical thinkers, looking at things in a little different light, and really interested to be investigative and supporting people in their journeys as well. So many of the people who are in the program and have come through the program are actually people who've been through the fire themselves. There are lots of professionals in different areas, such as nursing, you know, but also moms. You know, there are actually quite a few. Actually, I think most of the whole thing is moms, you know, or parents, right? The grandparents too. And they're just like been through the fire, and they want to help other people. And so, and that's the reason for us having such a large section about the actual coaching aspect in the month 5 is not only to learn how to do that and communicate with people, but also to take care of ourselves and to be able to know, because we're all very heart-centered. And we need to have, you know, that at the forefront of our minds, so that we don't burn out, so that we don't take on too much, so that we're not overwhelmed by our work, and make it work for us and our clients as well. So I'm going to look at this chat, see if there's any question. I take up to 20 students in a session, and I run the sessions. Well, I actually put an extra session in for a couple of people. It's a very small one. I did that in September, but usually it's like January, like the winter session, and summer. So I actually said it was spring last time, but it was actually the tail end of spring that we started. So it's like January, June kind of thing. And so I don't have too many students at once. Right now I have 2 sessions going on at the same time, so it's a really busy Sunday. And so sometimes I'm going, oh, okay, that's a little, because it's a very intense couple of hours of teaching. And, but usually that's how it goes, Chris. Okay, so I'm going to keep going with that. Okay, so I want to go through what we are and what we are not. And this is another thing that will help to identify what it is we actually do, because we're really creating this health coach thing isn't an old profession. Like you don't go, you say to somebody, I'm a doctor, I'm a lawyer, I'm a nurse, I'm a, firefighter, like all these traditional things, these professions, and people know what you're talking about. When you say I'm a family health coach, they go, well, what is that? And do I need that? And I don't really know what that means. So I'm going to tell you what it means to me and what it will mean when you get a certification from this program. This is what it means to be an HFF practitioner. So we don't cure people. We give them information, guidance, and support so they can heal themselves. Our whole program is about empowering the individual family to actually take the control of their own health. So we lead and guide people to dramatically improve their health, enjoy recovery from chronic illness, prevent disease, and maintain good health using lifestyle interventions. We provide nutritional, lifestyle, and self-care counseling. So we'll be learning all those things and then how to actually deliver that to people. We empower and inspire clients and others to take control of their own health, which is what I already said. So I guess I'm repeating myself, but heal themselves and families of chronic illness and to live a more vital and healthful life through education and support. So we do those things, and how do we do it? Through education and support. So we do, we make healing plans for people. This is sort of what we work toward when we start doing health histories and getting, background and finding out what the root causes might be. We actually help people to make plans in the end of, not the end, but at the beginning of our journey with those clients to actually make those changes happen. So let's say we identify my leaky gut, we've got an imbalanced microbiome, we've got trauma in the family, and this child has a sudden onset of some kind of chronic illness. Well, we need to go back, figure out what it is, and then we say, okay, this is how you deal with the gut. We put you on a gut healing protocol. But these things are, and we're very careful about our language. We make sure that they know these are suggestions for their interpretation and for their own decision making. Because it's not only that, it protects us, because we don't want to be, we're not doctors, and we're not trying to be doctors. We're trying to guide and support and lend education in this format, in this So what we want is for people to understand the human body, what will make them sick and what will make them well, and then we help them to plan in ways that they can do that. So that might be nutrition, lifestyle. It's actually always those specific things, but also, specific nutrients. So we talk about all that stuff and what to use, when to use it, why to use it, and then when to back off and what things to look for. And so there's a big focus on, the deficiency and the toxicity as well. So we also can recommend things. So if it's not in our wheelhouse, we say to people, well, massage once a week would be very beneficial for you. Or, what, have you ever tried this? Or I see that you're kind of really interested in meditation. Here are a couple of recordings that I've, dug up that I think is really useful. So we have lots of tools like that. And we're developing more and more all the time with easier access. Some of them are just suggested, and then we have to, as individual practitioners, look into them for our clients, or we get our clients to look into them for themselves. But we're developing more and more like quick links to things, and really faster suggestions to make the whole process a lot sort of streamlined, right? All right, so we help alleviate the stress involved with our clients' health challenges by being the support and source of quality information they need. And I think it's quality, but I don't think everything we say is going to be the truth forever. I mean, how many things that we actually believe as a society or as a medical community that's actually been debunked? Like completely, for instance, we were just talking today with my group, my fall session that started in January, and we were talking about the gut-brain axis, and we were also talking about the brain and brain development. And I was saying that, years gone by, we always thought that the brain, that was it. It developed to a certain level at a certain age, and that was it. There was nothing else that happened after that. And if there was any degeneration, that was too bad. It's aging, it's going to happen. But we know now that that's completely untrue. We know the brain is plastic. We know that it's always, we can evolve that brain. We can heal that brain. There are many, many, many ways to do that. It's just like when I hear someone with a brain injury, I go, we got this. You know, there's a lot we can do. A lot we can do. So, so I'm not saying that this program is it's like everything we teach is like fact, because this is a science. This is actually practice. And so we actually are on the top of the cutting edge of health and wellness and information and research. We are at the cutting edge, but that doesn't mean that it's the only thing, because we're going to stay on the cutting edge and keep learning and adjusting and saying, okay, this worked better than that. And, oh, we've learned this new thing. We're going to add that to our toolbox or to our wheelhouse of knowledge. So it's always evolving. So what my program does is it enables us to be much more dynamic in what we learn. So it's not, so again, Chris, that could actually come back to your question, is that we have a syllabus, we have a guideline, because there's certain things like the body, we need to have a structure. We need bones, we need skin, whatever. But whatever, though, there's so many nuances within each of those things that change and evolve, and that we can, you know, the change and evolve. So that's what happens in the program as well. So as I learn, you learn. And I just did a whole bunch of new trainings actually in September, because I can't help it. I don't know if you guys are chronic class takers. I can't help it. Like I go and I think maybe I should just like master that and leave it. No. So, and so whenever I learn, I bring that back. And so that's another really cool thing. And as people in the program learn, that's the thing that they do too, is they bring that back. So we do that as well in some of the presentations we have. So that's one of the assignments, and I'll get to that soon. So it's a really collaborative, beautiful family, actually, I consider it. And I say I'm building my army of healthcare, family health coaches, but it's really a family, actually. So helps clients to successfully complete a health overhaul, recover from chronic illness, or just improve their health to meet their personal health goals. Okay, so again, those are our goals. All right, so the program, I'm just going to go through the program. I'm not going to explain it too much, because I don't want to keep you too late tonight. I wanted to keep this at about 45 to an hour, so we're hitting like the 40-minute mark. So we should be done in good time, so that you have some time to ask questions, because like I was saying at the beginning of this session, there are a lot of people register, but sometimes people wait for the replay. And I didn't even say I was going to do a replay, but maybe I will. But for those of you who are here, you will have the opportunity to ask questions. So I'm excited that we have time that we'll be able to do that. All right, so the HFF Health Coach Practitioner Training Program, like I said, it's a dynamic, exciting hub of information and practitioners with a professional curriculum designed to empower trainees to really have the rubber meet the road for their clients in whatever capacity that inspires them. It is a life-changing experience. I think so. It is for me, both for the trainees and the people they will be helping. Trainees learn about the science they never knew existed and the intricacies of the human body never presented in such a manner before. The education through this program will give our students a comprehensive understanding about what health really is, how to achieve it naturally, and how to coach others to do the same. All right, so here are the requirements for the program, and it's sort of split on 2 pages, so sorry about that. All candidates for certification must complete all of the required readings. That's just a given. Pass all exams and the practicum. So what we have is the quizzes. You need to have 80%. We have a quiz per month. So we have quiz for Module 1, quiz for Module 2, all the way to Module 5. I think we have a Module 5 quiz, but we don't. No, Module 5 is actually the final exam. So we only have 4 quizzes plus the final exam. And so 80% to pass the quizzes. Final exam, same thing. The final exam is split up into 2 parts. One of them is a written exam, and the other one is actually a verbal exam. So, and actually, it sounds really, I want to make sure everybody knows what they're doing and comes out of this program with all of the teaching and the learning that I want them to have. But at the same time, there's lots of flexibility. Sometimes people need more time to write their quizzes. Sometimes people take 10 months to get through the program, but we have a 6-month programmed in time slot for the actual live sessions. So the live actually needs to happen, on schedule, but if people fall a little behind and then they catch up and whatever, I'm totally fine with that. I have 3 kids, 16, 19, and 21. I've been there. I have a very busy life, and some days I'm just like, no, that's not happening. And I don't want anybody to be stressed, because they're like, this needs to be a very good experience. And when you just say, look, I'm just busy, I'm good with that. And so I gently push, but I completely understand, and we're very flexible. And so with the exam, that actually the oral part is super fun. We do role playing, and okay, well, it's really actually quite fun. And so we get to be client and practitioner, and it's a really good experience. So you can ask a couple of the trainees who've been through the final exam, how they found that process. All right, so, and also Lisa's here, and she just did her presentation. So there's a presentation that is done once, just one presentation, and that's just to get your feet wet with the teaching component, because you will be teaching, even if it's one-on-one, if it's with a family, if you decide to do something like become like a celebrity, practitioner or something like that, if you're like, all those things, whatever capacity you want to use this education in, there's an element of teaching for sure. So when we're doing that, that presentation portion, you get a chance to do that, and it's actually quite fun. I see that I froze a bit, so I'm hoping that you could still hear me. But yeah, I hope that you can still hear me. But I can still see you, and I know we're still recording. So if anybody needs to go back and listen, I'll send you the recording. And if I broke up or anything like that, if I'm breaking up, just feel free to send me a message too and let me know and say, hey, Carla, I couldn't hear you, and I'll repeat that, no problem. All right, so participate in the discussion. So that's a requirement. And it doesn't have to be huge. It could just be a few things poking in the Facebook group. It could even be personally to me. I just need to know where you're at, what your questions are. I don't want people to get really quiet, and then I don't really know how you're doing and how you're faring in the program. So I really want people to participate. I don't have marks for participation, and I don't work that way. The only reason why I have marks is to make sure that I know that there's enough of that material that you have, comprehended and put into your brain, that that you've got a good handle on the whole program as a whole. But I'm not a big marker. I remember taking, I took Latin, and there was a requirement for my master's degree. I actually got a master's in English literature. And so when we did that, I had to have a language, and I thought, well, Latin will be way better. I know it's a dead language, and I thought, well, I don't want to take French again. I don't want to, and I'm not that great with languages, but I thought this would be kind of interesting because it's the root of English, right? So I took this, and we did it. We were in a park, and we were not in the park, we were on campus, but on the grass, and I would bring my son every once in a while, I think he was 6 at the time, and it was great, it was it was really much more relaxed. We learned in a very different setting. It wasn't stressful, although I probably didn't retain as much as I could have maybe, but it was a really good experience. And I want that experience to be really good for all the trainees. So, and write a final self-assessment. So after that all happens, everything's done, and, a self-assessment is a really important point of self-reflection and what happened with you in the program. And it's inevitable that people change and grow within a program like this, and that's the point. It's not just something that you learn and, put off to the side. It integrates within your being, and because we're working on a consciousness here and changing or expanding, into this whole concept of health and coaching people and helping ourselves and our families and the people that we work with. So we're change makers, right? And that involves change within the self. So I won't get too much in that and scare people away. But anyway, so program delivery. All right, so hands-on personal instruction by yours truly. And I always do that. I don't think I'm ever going to hire any sort of faculty unless there's something like, an advanced training. But even those, I really want to take care of myself because this is the vision that I have. I do have interviews that I do with people, but I'm always there. So, for instance, we're doing one with Dr. Sandy Gluckman coming up here shortly, and she's going to talk about the psychological piece and about this sense of safety being extremely important to instill with people. If they're ever going to get better at all, they need to feel safe, and their nervous system needs to be in parasympathetic, and they need to feel, for the vagus nerve to work properly, not have limbic dysfunction and all kinds of emotions carrying them away and reactivity. So anyway, she's talking about that. So I do have those experts come in on occasion. It's not like I'm promising to do it every week or every month even, but that's something we've been working in as we go. We did one with Armin Labs. We did a session like that. We talked about going through Lyme and co-infection labs and how, their technology, how it works, and, what how to read them and that kind of thing. So we do test interpretation, stuff like that. So we've got a whole bunch of different things on the go, as well as some that are already up there in the program. We have weekly lessons and readings. So right now it's Sundays. I don't think that's ever going to change. I know Sundays are hard, but evenings are worse. I find like people don't want to be tied up in the evening. So with Sunday afternoon has been our time for lessons. And that's once a week for live lessons. And then we take a week off every 5th Sunday. So we have 4 lessons in each module. And then the 5th, and then right after that, we have a week off to catch up on quizzes and readings, just to have a Sunday with our families, because I don't want to take up everybody's Sunday every single Sunday. Because even when you're finished, I mean, people from the last session are actually taking this one because they want to come back and redo it and be a part of those sessions and really integrate what they've learned. So that's always open to people if they want to just, attend those whenever they like. And so, yeah, okay, and reading, weekly lessons of readings, 5-month delivery of the program materials. Okay, and that's, we do quite a bit. I mean, it's not a ton of reading, and Lisa can actually let you know what she thinks. I'm going to let her talk, and hopefully it's all good. But we have but that's the materials. But yeah, like I said, if you get behind or whatever, there's time to figure out some of this stuff and get it done. A 6th month involves training plus required practicum. So we do have those sessions. More conversational. Actually, month 5 has a lot of discussion as well, as opposed to like straight delivery of information. And the practicum is performed in the 6th month. So that's when you're actually working with a client who knows your student, who's willing to work with you for that month. You are not going to get through huge issues with that one person in 1 month, but it's really to get you started and your feet wet in our process. Some of you are professionals already. You have a process in what you do. But some of us, some people don't. And regardless of whether you have done this before, something like it, or not, it gives you a good idea of what my process is, and it might be useful for you. So 5-month grace period to schedule and complete the practicum and any remaining coursework and exams. So must be completed within 10 months of the beginning of the program. Okay, I'm going to sound pretty hard about that, but I'm just going to don't tell anybody, but I'm okay with it taking longer. Okay, so just keep in touch. Can't drop off the face of the earth and then show up again like 2 years later. It's not going to be good, but I mean, I don't think you will. All right, so weekly studies and group training calls. So like I said, we have these group training calls on Sundays, quizzes and exams to ensure learning and integration. So we've talked about that. All right, so you can sort of look at this. I was already saying Sundays. Practicum months can begin after 5 months of the program. Okay, so if you're not ready to do your program or your practicum on month 6, you can say, okay, I'm done on my coursework. Can I start my practicum in 3 months from now? I'm not ready yet. It's Christmas time, whatever. Totally fine. We just need to schedule it in and make sure that we're keeping touch. I just keep in touch with people. That's why I keep the class size small. Otherwise, it's impossible to do that. And let me see here, month 1. Okay, so here we go. I'm going to go through the months really quickly and then let you ask some questions, okay? And then get on with your Sunday. Thanks for hanging in there with me right now. So month 1, putting on the training wheels. So about this training, unraveling the medical model, lifestyle medicine, and the functional approach. So this is what we are covering in that month over 4 weeks. So it's about, the first week is about this training, what we're going to do, how this is all set up. The next week is unraveling the medical model. The next week is lifestyle medicine and the functional approach. So that's split up into 2 weeks. So we have some information about those things in those 2 weeks. And we really could have like a 5-year program. But I mean, as we go and people go down different rabbit holes, they go deeper into the things they're really interested in. And what my purpose is to give you a really good foundation. So month 2, okay, wait, so we start thinking about the practicum, but you don't have to tell me about any of that until month 3, month 4 in there. Month 2 is pointed in the right direction. So that would be the essential pillars of health, functional basics, which would be physiology, nutrition, sleep, rest, exercise, and supplements. And then the roles of the immune system, detoxification, and deficiencies. And we'll also explore topics such as the central nervous system, the autonomic nervous system, which I didn't actually put there, the GI system, the mitochondria, the microbiome, and I put mitochondria twice, the virome, and epigenetics. This is really good to read it out loud because then you can catch all of your editorial mistakes. And I'm actually an editor and I have a master's in English. Okay, so that's not good. So anyway, but I caught that now. Okay, so good. I caught it now. Okay, so month 3, conditions and illnesses. So here we will cover a myriad of conditions and illnesses. So we're talking like a whole host of them, and we're not going to be experts in ADD or autism or anything like that coming out of that month, because there's no way we can do that. But I mean, it's really actually a week dedicated to talking about those things. And again, if you know the roots of, we're going to be really understanding what the basics of health really are, and then you can really apply to, all of our solutions to many, like everything that's chronic illness, everything, because you can figure that out. And that's what we learn to do in month 4 and 5, is to actually start doing the investigative work to figure out how to, like, if someone comes to you with MS and you're like, well, I don't know how to deal with MS. Well, actually you will. You will know. You will know, because you will understand autoimmunity and what that triad of issues are that lead to an autoimmune condition. And then if you deal with those things, then you can see any kind of autoimmune condition resolve. So that's big promises, isn't it? But I mean, I'll say that to you. So things such as ADD, ADHD, autism, cognitive decline, depression and mood disorders, addiction, autoimmunity, including RA, which is rheumatoid arthritis, MS, type 1 diabetes, etc. I actually even have a whole program about type 1 diabetes and optimizing the health of children who have that autoimmune condition, because it's come out. That's why I started doing what I do, because my daughter was diagnosed with type 1 diabetes. And once I started learning, I couldn't stop. So you can read about my story and everything online if you want to do that, if you're interested in that, what led me to this work in the first place. So type 2 diabetes, overweight, fatigue, and gastrointestinal distress, et cetera, et cetera, et cetera. Everything. I mean, we can actually help to improve the lives of people with anything that's wrong with them, even if it's a congenital issue, even if it's something they're born with, even if it's considered, genetic, which is probably maybe 10% of the issues that we see in health right now. Any of those things, we can at least help them to improve, at least help them to not decline, at least not to have comorbidities, which would be additional illnesses. We can do a lot of good with what we learn here. So we touched on subjects such as vaccines, antibiotics, and medications, and their alternatives. All right, so month 4, the HFF toolkit, which is healing modalities, the holistic model, creating protocols, troubleshooting, special topics such as supplementation and testing. So that's cool. I mean, when we say we're family health coaches and people think, we're doing all talk and whatever and support, and that's great. I think that is actually huge. Like, it's a huge thing that we do. But we also will have the access to testing, and that might mean that I have to kind of hold some hands a little bit. I might be the primary on that part of it if you're not familiar with certain tests or you're still learning, and I can help guide with that and help you to interpret these tests. But all of these tests are, many of the ones I think are the most relevant to do this work that we need to do. I have access to those. And then as we progress, you may be able to get your own access and such, but we do have a lot of access. And we talk about testing. We just did a session the other day, a trainee and I, we recorded a session where we went through the NeuroZoomer Plus. And so it's like a test that tests for autoantibodies like to the brain tissue and anything that can affect the brain as well. So we use that test in many different things like mental health issues, but also PANDAS and PANS. And now there are many actually applications for that test. So I've been really digging deep, and what she said, you can take this and share it with the group. And I said, okay, that'd be great. And so we did that. And so we went through it. And so you guys are always learning when I'm actually doing the work with you. So there's a lot of support that even goes beyond that. Once people are trained, they're even graduated, and there's still there's always way more to learn. Hopefully I'm a step ahead or something, so I can be able to help you with that. So we have access to testing, and we can also interpret tests. Some of them are quite simple to interpret. I mean, if you've got low serotonin and high dopamine, once we talk about neurotransmitters, it's pretty simple to actually figure out what's going on there and why they have the certain symptomology that they have. And then there's lots of nutritional interventions that we can have with that lifestyle, like, getting those kids off of those video games. That's huge when we have dopamine issues. Huge. And, like exposure to Wi-Fi, and things like using tools that will sort of boost certain neurotransmitters, like GABA or L-theanine, those things. So we have those tools and be able to monitor them as we're trying these things or suggesting them to them. So that's just an example, a small example of what we're learning in that month 4. Trainees become empowered with safer, more effective, and natural means to help their families and clients achieve optimal health status. So by the end of this month, I'm kind of wanting to know what the practicum client is going to be. Again, probably like 25% of the trainees tell me by then, so I'm poking people, but I'm good. I poke people and I push, but I also am pretty understanding. So I'll just say, hey, you forgot about that. And they're like, oh yeah, I did. So that's what we're doing by the end of month 4. I want to know what's going on for practicum clients. And so month 5, the map to better health, how to be a health coach, assessing your client's needs, advocacy, creating compliance and ensuring success, and creating supports for your clients' review. So it's just creating supports for your clients. And then we also do a review and a comprehensive exam. That's when you start the exam. I'm very generous with the time it will take to complete that exam, the written portion. I actually give a whole month. I said, whenever they request the exam, you have to request it and say, okay, I'm ready, Carla. I think I can, manage that time. And because I think that a lot of learning it's not memorization actually at all. And to tell you the truth, like really it's integration. And so I want to see, I would rather you have the exam for a month and research and look up stuff. If you miss something, I don't think you're going to need to do that unless you have like big time constraints and you work a full-time job and you've got 5 kids. Like, if you're busy, you're busy. But when you request the exam, you could probably sit and take it not that long. It's but there is a written component and there will be a, you could do it in a day, if you, not a whole day, but you could do it, sit down and do it in a few hours. And, but sometimes people just want to take it in chunks, and that's fine because you will learn it much better. I have no problem with that. I think that that's a much better way to go about it instead of the pressure of like doing it in 2 hours and you're timing out and like, I'm not interested in that. So month 6, where the rubber meets the road, practicum. So this is when you perform your practicum, finding your niche and how you want to use this training, preparing for graduation, creating your practitioner profile, practicum report, and self-assessment. So this is reflective. This is where you decide how you fit into the world as a practitioner, what you want to offer to your clients, or what you want to add to your existing client base. So you're able to actually use the skills that you've learned and the knowledge to actually either add to whatever you're doing already to make a new career for yourself, or to just work with your own family. Some people take trainings like this, like I did, to just do it for my own family, and that's totally fine too. I have no problem with that. Some people take this training and they want to just do like educating of like groups of people, or take it to their nonprofit and at whatever volunteer work they do, or they need to make a living at it, which is, I would suggest people always do that and honor their time and their effort. Because again, like I said, we're all very heart-centered people, and we need to learn how to take care of ourselves, but at the same time, make our services accessible. So we talk about all of that stuff in month number 6. And then at the same time, the practicum is happening. So you can start your practicum in month 6 while we're discussing all these things, or you can sort of defer it to month 7 or 8 or 9, like depending on your time, how you can allocate your time. So there's materials here. You'll get a practitioner guide. Lisa's group's waiting for it. It's not quite done yet. It's like the bomb though. So you'll be getting that by the time Lisa's group is graduated. They'll have that. They graduate in December. So they finish the coursework anyway in December, and then depending on when they do their practicums, that's when they each graduate one at a time. And so, and that's included in the tuition and received upon graduation. Printable materials, including studies, articles, HFF materials, and the required readings list. Printable materials are available on the course page, but trainees must acquire their own additional books. So you can print it. When I say printable, you can print it. I don't have a manual that I send out at this time. I actually don't know if I ever will, because this is so dynamic that sometimes things change and then I've got to resend it all. It's just a cost that, you know, I don't want to have to like absorb or to pass on to client or to students. So to keep everything reasonable, manageable, less administrative, it's all there. So you just click on it and print it. Some people don't like to read it online. I don't like to read online myself. So you may have to print certain things. And then you can just keep it in a binder, that kind of thing. So it's, you know, so at this time, that's how it will be. If anything changes and people think that it's much more beneficial for us to change, you know, we just work on stuff and change things. So this is the practicum. You know, we make a healing plan. It's supervised by me. And to pass, trainees must demonstrate that they are able to put their training into practice in a real-life situation and that they have the skill to maneuver through the many challenges that will come up as they work with real people who have real lives. Okay, so this isn't perfection. This isn't like my client was healed in this month. That's not going to be realistic. It might happen, but it's not what we're going for. We're going for empowerment of our clients. We're going for, you know, improvement, you know, better life, better health. I want to see demonstrated that you're able to do that and troubleshoot as you go. All right, so, and then there's a written report about their experience with the client and develop a healing plan complete with research and suggestions. And then there's all kinds of, like, there's information. You have the assignments are actually written out. You can download the instructions. You can read them from the website. So that's all there. All right, so graduation notes. So upon graduation, you will receive so the professional designation of HFF Family Health and Self-Care Coach. We've been playing with that name, actually, so I even put out a poll in the Facebook group, like, what do you guys want to call yourselves? Because we can do whatever we like. I mean, this isn't wishy-washy as far as what we learn and the education and the quality, but the name, you know, it's all about the name and how people see that and how what they understand that to be. And so this may change a little bit because when we say family health coach, they have no idea. I mean, there's no indication that we actually can do testing. We can interpret tests. We can dig deeper in the functional aspect, that we have like an understanding of the mind, body, and spirit. Like that says nothing about that. It says really that we're helping them to get healthy, but that doesn't say what we do. So we're still playing with that. We might never actually come with something better than that because, you know, it's really, I mean, you can't say all that in one title. But what my goal is to make sure that when people see that, they get it. They're like, oh, I work for the HFF Family Health Coach. I know what they do. And so that's what we're busy doing in the background, is developing that, like building our reputation so that people, when they see that, they're seeking us out. And so we're seeing that happening already. All right, so a beautiful diploma to display in your home or office. I don't even know why I put that. That's cheesy. Okay, so a digital and hard copy of the Family Health Revolution Coaching Manual, designed to be a reference encyclopedia of everything you will have learned throughout the course, complete with sources, references, and suggested protocols and coaching tips, and updated every year. So this is really, it's basically like, it's my Family Health Revolution book on steroids, because it includes some things like, you know, protocols and stuff that aren't static, and they're like, I hesitate to use the word protocol because that it indicates that one size fits all, and it doesn't. But it has more information for people who know how to use this, or need to know how to use this information professionally. So it's not like I'm going to go say, yeah, everybody take, you know, a whole bunch of like, I don't know, melatonin at 250 milligrams and do it, you know, take a suppository. Like I'm not going to say that in a book that's for the general public. I need, you know, so it's going to be sort of a souped up version of that book for practitioners. So beyond graduation, when you've completed the program, you'll be qualified to lead and guide people to dramatically improve their health, enjoy recovery from chronic illness, prevent disease, and maintain good health using lifestyle interventions and without medications. Provide nutritional, lifestyle, and self-care counseling, empower and inspire clients and others to take control of their own health, heal themselves and families of chronic illness, and to live a more vital and healthful life through education and support, and help alleviate the stress involved with your clients' health challenges by being the support and source of quality information they need, and help clients to successfully complete a health overhaul, recover from chronic illness, or just improve their health to meet their personal health goals. Okay, so we've been through that already. No, so at the end, you know, we come up with, we have a referral program for our graduates, so people are looking for a practitioner. We're developing that program right now. Personal practitioner about me webpage, so we have practitioner profiles, and I'm working with a couple of people that are graduates, like it's just, you know, it's whatever their process is. They're developing their information for their websites right now. Practitioner hub for troubleshooting client cases and sharing resources. Love it. We're on Facebook right now. Facebook isn't like the safest place in the universe, but you know, it's really working for us at this time. Ongoing opportunities for professional development, ongoing support for our community of practitioners, quick links for practitioners, quick links for clients, lifetime access to recorded lessons and materials, and possible future HFF practitioner conferences and meetups. Now that's kind of exciting. I mean, I'm thinking, wow, if we get to have a personal and in-person meetup, that would be fun. Because you know what? I like karaoke and I like to dance. I mean, I like learning, and I can be very serious when I need to be, but then I'm like, we need to let her rip, girls. Like, this needs to be fun. We need to be able to enjoy life, right? We need to enjoy life. So my conferences would be a little of both, right? I like, you know, so that we work and we learn and we're like a think tank, and then we just like, we take care of ourselves and enjoy each other. So, all right, so applying your certification, there's a bunch of stuff. I'm just totally rushing now because I feel like I don't want to keep you much longer. I just have it's actually pretty quick. Okay, so different things you can do with this, and the sky's the limit. I really feel that, you know, whatever people do with their certification depends on their own personal background, what they know, what they do, what they want to do, their demographic they want to work with, you know, their passions, you know, what set them on this course in the beginning of discovery. So stay within the fold of an HFF practitioner. I haven't had anybody leave yet, so that's cool. You know, so, you know, most of the time, you know, you're still considered within that fold. If anytime you want to stay, you know, you're an HFF practitioner. I mean, there's a couple of designations I have that I actually don't identify with when I introduce people, like when I'm introduced to people and I tell them what I do. So that's what I mean. You know, if you want to be considered an HFF practitioner, that's completely, you know, a decision you can make, but you don't have to. It's just available for you. Work with individuals and families in their health goals as an educated professional in the field. So that's something else you can do. Educate through podcasts. I mean, podcasting is very cool. It's like very hip, and you know, a lot of people are doing it now, and it really learning a lot from information they find in podcasts. I love them, actually. I mostly do summits. So some of you might know me through my summits, Children's Health Summit. So that's how I broadcast in a visual way, you know, or in interviews for people that want information. Blogs, newsletters, books, articles, studies, and speaking engagements. And there are ways to make livings in each one of those categories, or to add to what you're doing, you know. And so some people do all of those things. I do all of them, kind of. I don't do studies. I guess I don't do that one, but I do mostly all the other stuff. Apply the certifications to your existing practice or services. Again, you know, we were talking to Heidi earlier on. She got to introduce herself and tell us what she does already. So this is something that would be something like her, or like lots of nurses. Like I said, we've got several nurses and other professionals in the program right now, actually even health coaches. And start community initiatives, outreach programs, partnerships with other healthcare professionals, focus on patient advocacy, crisis intervention, and or coaching support. Not everybody has to do crisis intervention, do really heavy stuff. You can really just coach families into good health. You know, that's totally fine. I tend to do quite a lot of crisis intervention. That's just kind of where I'm at, I guess, and people that I feel that there's a real need in that category. A lot of people have environmental illness, you know, things like pandas, and they're going down the road of psychiatric medication when, you know, it's a physical issue. So I do lots of that work, and chronic illness, you know, but you don't have to. I mean, that's not anything you need to do. You're just equipped to do that. Specialize in mental health, detoxification, addictions, nutritional therapy, autoimmune, children's health, geriatrics, stress reduction, etc. So you can specialize depending on what you know, what you want to actually focus on and drill into. Develop online and in-person programs, supports, and services. Open an online practice or even an in-person clinic. So we have a few people who are going to do that. One of them already has a clinic. So, you know, that's something else that you can do. And the sky's the limit. I mean, this is just stuff I brainstormed and came up with to put here. So, again, what do you imagine your part in the family health revolution to be? I mean, that's the question you ask yourself when you come to the end of this program. And basically the program throughout, you know, you're finding that out. So there's me. I have a bunch of stuff. I'm not going to read all this. This is my background, why I started to do what I do. And that's all on my website on healthyfamilyformula.com. There's an About Us page, the thing, and it says About Carla, I think it is. So that's the page that there's a bit about me. There's a little bit of a write-up, and then also my educational background. It looks like, you know, I just want to list everything known to man, but I really want you to know who I am, what I've done, what I've studied, and so that you know what you're able to learn from me. So if you want to check that out, go right ahead and have a look there. It's all on my website. And then, see, here it is. There's the link, but you'll be able to just see it from the main website, healthyfamilyformula.com. And if you're all on my website or my newsletter list, there's a link to that website. I think you just click on the logo and it'll take you right to the website. In every email you get from me. So the tuition, Kate, now we always have to talk about this because everybody needs to know up front how this works. I charge in Canadian because I have no choice, and it's so annoying because it looks like people go, oh my gosh, and it's like, no, this is Canadian because our dollar's worth nothing. So US dollars, you just, if you're in the US, which many people are actually. I have students actually in Europe. There's some in England and some Israel, Italy, Australia, and some, you know, and then there's like US, all over the US, including Hawaii, and then there's some Canadians in there. So we're all over the place. So it just depends, you know, what your currency is. You'll have to do the conversion. And then I take payment plans. So I do 5 payments, 10 payments. And I also give people a little bit of a break on tuition, a $500 break if you pay for the whole course in one payment. I'm kind of like, it's not good, but I'm kind of a one-woman show in a way. And so I do a lot of the administrative stuff myself. I accept people myself. I handpick everybody. I communicate with everybody myself for now. So as long as I can handle doing that. And so it's just, that gives me a break from chasing people down and asking for it. I don't like the money part. I have an issue with that. That might be just me. I'm like, no, never mind, don't pay. No, I'm just kidding. But, you know, so it's like, it's just a less of my, like administrative time is when people when they pay up front. So I just give people a little bit of a break on the tuition so that, you know, that's like a little incentive to kind of just, you know, if you can, to pay up front for that tuition. And then application. So there's an application process. And so applications are reviewed immediately because I really would like to have this course filled up within the next couple of weeks because I want everybody to enjoy Christmas. I have a book to finish editing, and everybody knows that they've been waiting for a while for that to happen. So I just want to get this out of my way, and then we're ready to rock for January. So I have a first come, first serve policy. So I don't accept people like you don't get accepted the first second you apply if there's room. First, there's an application. So of the accepted people, then there's a first come, first serve through people that are accepted. I don't turn a bunch of people away, but I do want to see that there's an effort made to apply to the program. It's a professional program. And also I want to see what the background is of everybody and get to know you. And also see how if it's a good fit for you. And I don't want anybody to go into the program thinking, well, this isn't what I thought, or this doesn't fit me, or I'm not ready for this, or I'm not right for this. I really, actually, it's a reflective exercise to write even just a paragraph to say why you were interested in the program, and then to give me your resume so that I can see who this is, because it's so wonderful and enriching to see what people are actually attracted to this program. And then it gives me a bit of information to sort of tailor and, you know, and bring more things in that I think might be relevant to the people that are in that program at the time. So that's why we have an application process, and it's a professional program. And it's run professionally in that regard. Although I'm pretty personable and, like, you know, have a lot of fun, but we do have that aspect to it. All right, so, and it fills up first come, first serve. So I only accept 20 participants per session from the people who apply, at which point the program will be full and the workload at capacity. It's a lot of work to keep track of everything, so I keep it at 20, and then I can be there for you. Sessions are offered every 6 to 12 months. So that was an answer to Chris's question that I answered earlier too. All right, so application process, I explained that. So really you need to I don't compare people. Like I don't go, oh, this is this big group of people and this person's better than the other. That's not what I do. That's not at all. I see if you're a right fit and you've made that effort to apply, and then that's what I go on. So it's not about competition, and really that's why I have a first come, first served. And then if it's full and there's more candidates that would have been really good for the program, then they'll have to wait till the next session. Or I might, yeah, it's too much to do a whole bunch at once. I'm finding that right now. So it's not too much. It's just more than what I want to do. So you send your letter, cover letter, and where you answer the question, why do you want to take this program? And there's lots of different reasons why. A lot of times people have a health challenge themselves. Maybe their child was ill, they recovered, maybe they had a health scare. They might want to help the other clients in a different capacity. And then the second thing that needs to be sent in that email is a cover letter, or a resume or a CV, right? So just to get an idea of your background and interests, and I already said that. And then we schedule a third. If you're accepted, you get all that information about what happens from there on in. So, and then you go into the Facebook group, and you could totally have a look around to see how we talk to each other, what we do. You get invited into or you get welcomed and that kind of thing. It's pretty fun to be there. So, and then I'm not going to read this little note, so I'm going to leave the rest of this. Sorry, I'm making you dizzy. There we go. I'm going to stop my share, and I'm going to open the floor up, and there's only a few of you here, like I said, so that's great because we have a chance to do this, to be able to ask your questions. If you have anything to ask, and any one of you is welcome to talk at any time, and Lisa's part of the program right now, so she's welcome to pipe up and answer questions too if anybody has questions for Lisa about her experience in the program. And I'm cool with you being honest and asking and being just like, straight up about the program, because I want it to be something you are like all in. If you feel this is for you, I want you all in. So I'll leave it up to you. My throat's sore. Someone talk, because I had to have some coconut water because I need some brain power and some water. Oh, you're on mute, Heidi. Are you trying to talk? Okay, I'm going to unmute you. There you go.
Okay, great. It's just easier than writing a question. So I live in the US, and like I said, I'm a licensed psychotherapist, so we have a certain scope of practice. So what I'm trying to figure out is, with the training, it sounds like you get a tremendous amount of information where it'll take me past the point where I am now, where I have enough information to be dangerous, but more information than just saying, oh, go get a functional doctor yourself and take care of it. So I love what you're saying. I just want to make sure that this is information I can take and use without someone suing me. I guess that's, that I don't know what the scope of, I guess it's a new field, right? So what is the scope of practice then? And like, you're also talking about testing. Can we order testing? I always thought doctors had to do that.
Yep. No. Okay. So here's the thing. So scope. I'm going to answer the first one. The first one first. Scope of practice. I've actually developed one that actually the practitioner signs, so that we don't breach our scope of practice, because we can actually give our program a bad name, claiming to do things we can't, or saying certain things in the name of HFF practitioner program, and we can't. So I have something that people sign that outlines all of that, but also that clients sign upon, you're beginning that relationship with them. So it really is very clear about what we do and what we don't do. So for instance, we don't diagnose, we don't claim to treat, we make suggestions, and we guide people, and we lend support and education. And so we have a specific a stance or a way we view health, and we're very clear about what that is, but we're also clear, like our healing plans are actually suggested, opportunities for health. So we use words like that to make sure that it's very clear that we're not curing anybody or claiming to, treat anyone. And so when you're a profession, you probably do talk in those terms. So that'll be a little bit of a stretch for you to sort of like flip over to talking about, the coaching aspect. that this is something, but it's more like for you, I could really see you using it as an adjunct and saying, hey, you know, you could look into this, you could look into that, and not necessarily go through that whole formal process of a healing plan, maybe, you know. So we would work on that together. I think, you know, we could put our heads together to make something tailored for you in a way that you can work with your clients and integrate it. So that said, so there are 2 documents. I go through them right now, but we would be here a while. And I also, so I could send them to you if you would actually like me to, Heidi. So just let me know if you want me to send those to you. Yeah. And then, about,
great.
Okay, sure, I will do that. So I'm going to get, so if you could email me, and I'll give you my email actually here for everybody here, because you're going to need it anyway. I'm just going to type it in, c.atherton@sasktel.net. You could even reply to any email that I sent you from the newsletter. You just reply, and that's me. So pretty easy to find me. That's my personal email address. And then so it's very clearly defined what our scope of practice is. And then also, the second question was about testing. No, you don't need a doctor to do a lot of tests. And actually, a lot of doctors don't have even accounts with a lot of these independent labs. So I got a lot of access because of the education that I got, and they deemed me, I guess, you know, approved me to do this testing. So, you know, I have accounts with labs like Vibrant Wellness that does a whole host of things from neural, you know, autoimmunity to food zoomers, which is like like zooming in on specific food items that could be creating any like some kind of reactivity, to, you know, even some of the general lab work that's like thyroid or, you know, connective tissue disorders, like just all kinds of stuff through that one lab. And so because of my background, they granted me, you know, a account. So through me, there's lots of lab testing. And then if you want to, you know, pursue your own accounts and stuff like that, I don't charge extra like to do that, or, you know, so I just I give access to that through me, but then I'm just sort of like, you know, I'm there as a supervisor. But that's a lot of those labs do that anyway. Like for instance, Dutch Hormones, you know, I have access to that lab through my FDN training. And really, you just really have to be a smart person, and like all of you are, and just be able to learn how to interpret them if you want to be doing that on your own. And I do a lot of teaching, and we kind of work through that stuff and how to do it. So again, Dutch Hormones, they give actually their clinicians actually make a report for every single one of those, the lab results. So, you know, and you're not on your own in any way. I mean, so we have access to the Great Plains Laboratory. So Vibrant Wellness and the Great Plains both do mycotoxin testing. They do glyphosate. They do tick-borne illness. You know, they do like a whole host of them, an oat test. And there's not like, and I have my favorites. So that's why we go with my favorites and the ones we have access to. So anything we talk about, you can actually do through me or get your own account. So it's cool because you don't need that doctor. I mean, like, not that you know, it's just sometimes it's just so frustrating for families to get the information they need. And sometimes those tests is like, and I use the word antiquated. I mean, some of them are just not complete. They're not really good at identifying immune deficiencies or issues, not good for foods. Like they don't have any food sensitivity testing actually in the traditional medical tests. Like there isn't anything. So except for the scratch test for, you know, the immediate, you know, reactions. But so, you know, we have access to many highly, I guess, advanced testing is what I want to say. And then I have a question here from Chris. What type of business support do you offer to assist grads? I hope I answered that too. I was kind of blasting through the end part there where I was talking about where we make, you know, everybody has like a practitioner profile that we put together. We talk about how to do that. You know, what I'm doing is building the reputation of the HFF so that when people need a practitioner, oh, she did. Yeah, so she said I did answer that. No problem. So yeah, so all those things. So good, yeah, good that you got the answer you needed. And so that's how we support in that month 6. Throughout that month, we do that work. And then I've got another question from Chris. I have an HC certification from IIN. Yeah. Mm-hmm. And then along with several other specialized courses. What will this program supplement, integrate previous education? So you need me to answer that, right? Just let me know, because I don't want to blather on and you're like, yeah, you answered that already. Okay, yes, please. All right, so again, I mean, I get that question sometimes when people have already done health coaching designations, and it would have actually been good to have Michelle here, because she's done a few and she's the one that has a practice already. And so I think what I bring is a whole new element to that whole concept of health coaching. I have another student right now who's currently taking another health coaching designation at the same time, and she's like, it's so different because they don't talk about sorry, I just got distracted because Lisa had to drop off. But they don't talk about, the family and pediatrics, and they actually avoid talking about children because nobody wants to be liable. And that's why, some of us have to be brave in that sense, but not get in trouble by saying, yeah, dose your kid with this. Like, we have to know those nuances. Children are different. But actually we can do a lot of work with kids if we know how to do that. So we talk about doing that. We talk about coaching children and whole families. My whole concept is not just the individual, as you all know. What we do is children oriented. And I feel like our community is a lot different. We stay on the cutting edge. It's not cookie cutter in any way. Not that IIN is cookie cutter, but I think we go way beyond that. It would be good. I actually hook you up with one of my students right now and see if she'd be willing to talk to you, because then she can compare with you, because she's taking a course quite like IIN. I don't think it's IIN, but it's a nutritional consulting. They're really heavily focused on that portion of the health coaching. So I can connect you with her if you'd like, Chris, and I can see if she'd like to talk about that, and then you can get more information about how they compare. Because I've never done IIN. I've looked at a lot of their stuff and really considered it at one point of time. But I think that's really where we stand apart, is that family aspect and that whole community and being on the cutting edge. We do, I think, more functional medicine actually than they do with IIN. Like I said, they're very nutritionally, as far as I know, nutritionally focused. And they do a lot of other things too, but we do the functional part. We bring that together as well, and the testing as well. I hope that answered your question. Oh, Lisa had to go. If anyone has questions, Carla can share my email and I'd love to respond. Yeah, Lisa, and I'm going to totally record myself saying that. If I would have let Lisa talk, we would have been here, because she's like, loves to just discuss stuff, and we have such great conversations. So it's too bad she didn't have a chance to say anything, but she said that, I can give her email address out to people and if you have questions so she's currently in the program right now. She's in month 5. So she's not a graduate yet, but she's experienced the program right up to this point. So we're in month 5, week 2, actually, with her group. And then Chris says, the children family aspect is what is attracting me to your work. Sure, always interested to talk with other HCs. I'm in your Facebook group, so maybe an interesting post for online convo. Yeah, okay. Oh, you're thinking like Children's Health Summit? That one, the Children's Health Community? You can say yes or no, or it's the Healthy Family Formula. Yeah. And I'm sorry, I'm so lazy in there. I'm really, and then I started getting a bunch of spam that I had to start erasing, where people were advertising for like Juice Plus and stuff. I'm thinking, this is not what it's for. So it kind of got a little tainted in there. So I haven't been in there much, but I really want to start putting more information for parents in there. So, and people posting. So if you ever want to post something interesting, have at it. Because whenever I like it, that means yes. And you can always just run it by me too. But anyway, so yeah, it would be an interesting post for online convo for sure. Yeah, so I will consider that, like putting it into the Facebook group. But if you have questions, email me, and if you want me to connect you with any of my current students or past students, just let me know, and I can just ask somebody to show up. I know one of them is scheduled to show up tomorrow. I know you probably don't want to do that, this whole thing again, but if you want, you can come tomorrow, like later on in the session, and just pop in and see if there's one of my students in there too. So yes, okay, great, good. Any other questions for me before I let you go for Sunday night? You're good. Thanks so much for coming. And yeah, you have a wonderful evening too, Chris. Pardon?
Thank you so much, Carla. It's great to meet you online.
It was great. Thank you so much for coming. And just email me, reply to any of my emails, or use that email address I just gave you, c.atherton@sastel.net. If you want me to send you this info package, or if you have any questions, or if you want me to hook up with one of my students to ask questions, that'd be great. And if you just want to apply, go ahead, apply through that email address as well. Okay, bye-bye.